Kia ora koutou. Welcome everyone to our seminar on impact evaluation by Scott Bayley. I'm Marini Sanka, the New Zealand convener of the AES. Before we begin, I acknowledge the traditional custodians of the many lands which we join from today, and I pay my respects to elders past, present, and emerging, as well as to the leaders from all the nations represented in this seminar. This seminar is recorded and will be uploaded onto the YouTube channel in about 2 to 3 weeks. So demonstrating robust evidence of impact has always kind of had a contentious history of being too hard. And people often, evaluators sometimes put it on the back burner. So today we are really fortunate to have an expert in the area, Scott Bayley, to show us the ropes. Scott Bayley, a fellow of the AES, has held senior roles at Oxford Policy Management, DFAT, the Asian Development Bank, and the Victorian Department of Human Services before starting his own consultancy. Scott has advised several international organizations, including the United Nations Secretariat of New York, the Evaluation Capacity Development Group in Geneva, UNICEF, and the International Organization for Cooperation in Evaluation. Scott is also the author of over 70 reports with extensive expertise spanning in multiple fields, including international development, health, education, children's services, Indigenous affairs, environment, infrastructure, capacity building, and good governance. So we're so pleased to have you today with us, Scott. Thank you so much for coming, and over to you.
Hello, everyone, and welcome. I think it's terrific. We've got so many people joining us today. And my goal for today is to suggest an approach to impact evaluation that is credible, practical, and useful. I'm going to invite you to think about impact evaluation in a different way. And this is really a big ask. I'm going to ask you to fundamentally think about it from a different perspective. And I'm going to argue that impact evaluation is primarily about testing causal relationships, and we need to focus on our evidentiary requirements rather than our favorite method. We all have our favorite methods. You know, somebody likes experiments, somebody else likes case studies, someone else likes econometric methods and statistical analysis. I'm going to argue that that is all very secondary, and it should be secondary in our thinking to being clear about what evidence we need to reach defensible, credible conclusions. So if you have any questions as we go along, I'll ask you to put them in the chat function, and I'll come back to that at the end of my presentation and go through them. And at the end of my presentation afterwards, we'll send you a copy of my PowerPoint, and I've got an annotated bibliography I have that runs quite a few pages that might be of interest. So in my presentation, occasionally there's a reference to an article or something. Well, all of that stuff will be in my annotated bibliography, and you don't have to make so many notes because you can get a copy of my PowerPoint afterwards. So with all that in mind, I'll make a start. Oh, just letting more people in. Thanks, Marie. And I'm waiting for Mr. PowerPoint to move forward. There we go. So I've got a couple of initial examples to talk to you through that helps illustrate some points I want to make. I'm going to talk about philosophy and impact evaluation models because the two are more closely aligned than most of us realize. Number 3, about evidence requirements for impact evaluation. That's really my main point I want to make. We'll do some practice together. Well, I'll talk you through some examples with so many people online. And then I'll give you a summary. Then we'll have a quiz question at the end. This is real data. There's a very strong correlation between the number of people who died falling out of wheelchairs and the cost of potato chips. Now, first of all, this might seem kind of silly, you know, just a bit of random whatever. And I thought about this for a while, and I realized that shops put high profit margin items at eye level. So it's easy. You ever notice you have to bend way down for the chocolate or for the eggs, but high profit margin items in supermarkets, they push them at eye level. But people in wheelchairs, of course, are sitting down lower, so they have to reach up. So I think what's happening here is a person's in the wheelchair, they're reaching up for the potato chips, they fall out, hit their head, and die. As you probably realize, I just made up that explanation. It means nothing. It's total nonsense. But I ask you to notice, for a relationship that was entirely spurious and meant nothing, I could come up with a plausible explanation. Human beings are masters at detecting patterns and relationships. It's how our brains are wired. It's how we think, even when no patterns actually exist. So we can see animals or faces in clouds. We can come up with a after the fact justification for a spurious correlation between wheelchair deaths and cost of potato chips. How often does that happen in our program evaluations? And just as we all experience visual illusion, so too we all experience cognitive biases. It doesn't matter how smart you are or how well trained you are, it's because of the way our brains work. We're very susceptible to a whole range of other biases. When my daughter was young, I asked her one day, she was about 11, I asked her one day if she'd done any study for her mathematics test at primary school later that afternoon. And my daughter literally said, "Oh, Dad, I'll study hard next week in order to get a good grade in today's exam." And I said, "Lisa, how do you think that's going to work? Your exam's today and you're going to study next week." Well, that is obviously nonsensical because causality works forward in time. We do something today to cause something later into the future. It doesn't work backwards. You can't get a good grade in today's exam by studying next week. And that's the point I want to make is temporal order. Causality works forward. In this little cartoon, the little boy is saying, "I wish they didn't turn on that seatbelt sign so much. Every time they do, it gets really bumpy." So the seatbelt sign comes on in the airplane. Young fellow feels all these bumps and he's blaming the seatbelt sign. Well, of course, yeah, there's a correlation happening here between the seatbelt sign coming on and the experience of turbulence in the airplane. But what's actually happening is there's external turbulence that leads the pilot to turn on the fasten your seatbelt sign, and that external turbulence causes the bumpy ride. So, yes, there's a correlation between the seatbelt sign coming on and the bumpy ride, but something else, in this case, external turbulence, is causing them both. And this is a huge challenge in impact evaluation. These third variables that cause other things. And I'll come back to that in a moment. It's not widely appreciated, I don't think, that the study of causality is actually a branch of philosophy. And there's quite a few different schools within philosophy, and most of these schools have a corresponding evaluation model. For example, at one extreme, there are those who say impact evaluation is all about finding universal laws that are determined mechanically like a clock. The philosopher David Hume thinks that way, as do some of the essentialists. When you hear people use the phrase, this was a necessary and sufficient cause, that's actually a phrase that essentialists use. And they see causality as being deterministic. If this happens, if this cause happens, that effect must happen 100% of the time. And that's where they get into necessary and sufficient. At the other extreme, way over on the other side, about as far away as you could be, we have people called constructivists. Constructivists don't believe that there is no external reality that's independent of ourselves. All we have is socially constructed perceptions. That's everything we see and do is about socially constructed perceptions. They don't believe in causality. If you ask them to do an impact evaluation, a constructivist would say, well, I'll portray the perceptions and experiences of program participants, but there is no such thing as causality. And good example of them is Lincoln and Guba and their fourth generation book. That's what they're doing. They're constructivists. Whereas the American evaluator who did all the experiments, Borch, he was more of a positivist who believed in deterministic causality. Within those two extremes, there's another dozen schools of thought. There's, I don't know, Karl Popper, who believes that the name of the game in research is to try and falsify theories. There's Platt, who has his ideas about methods. There's John Stuart Mills, who an English philosopher who I really like, who offers criteria for causal analysis. But the one I'm going to talk about now is called critical multiplism. It's a evaluation model that has some take up in the US, virtually unheard of in Australia and Asia. And people like Shadish, Cook, Reichardt are advocates for critical multiplism. And in this school of thought, there is an external world that's independent of ourselves, but we can never know it perfectly. The best we can do is try and study it from multiple angles and get a somewhat distorted, slightly inaccurate picture of it. They believe in using multiple methods. They like to try and apply this John Stuart Mill's 3 criteria. And did I mention that causality is probabilistic? And by that, I mean, I'll give you an example. If you smoke a package of cigarettes every day for 30 years, about 20% of us will get lung cancer. And at the same time, similar people who've never smoked in their life, slightly less than 1% will get lung cancer. So I make 2 points with this example. One is some people get lung cancer who never smoked. The impact of smoking is the difference between 20% and 1%. And also notice, of the smokers, not everyone got cancer. 20% of the long-term smokers got cancer, not 100%. So in critical multiplism, when we say causality is probabilistic, that's what we mean. Those who participate in the program are more likely, in a probability sense, percentage terms, to achieve the outcome, but it doesn't mean 100% of them do. Now, if this all sounds slightly confusing at the moment, that's okay, because I'm introducing you to a new way of thinking about things, and it might take a while for me to start making sense. So don't worry if at the moment it seems slightly confusing. I'm going to come back to these principles several times in a few different ways. I'm arguing that in order to conclude that program X causes outcome Y, 4 criteria must be satisfied. I'm trying to keep my use of terminology and symbols to a minimum. I've used X and Y because if you pick up a textbook, that's normally the terminology you will see that programs or treatments, interventions are given the term X and outcomes Y. So that's what I've used. I'm saying if you want to do a credible defensive impact evaluation, there's 4 criteria or evidentiary standards you need to meet. And the first one is we need to demonstrate an association between participating in the program and achieving the outcome. People who attend the program do better than people that don't. That's the first one. That's relatively straightforward. We need to establish the time order. That is to say, they participate in the program first, they achieve the outcome second. The example of my daughter and her study habits was about temporal order, where she was going to study next week to get a good exam result today. But it works the other way around. Interventions happen first, outcomes happen second in time. And third, we need to rule out the alternative explanations for the achievement of the outcome. I'm calling those things Z, the external alternative explanations. The child on the airplane who confused the fasten your seatbelt sign as the cause is an example. The external cause was the turbulence outside the aircraft. That was the external alternative explanation. And then finally, we need to identify a plausible mechanism linking the program and the outcome. So I'm arguing, and this is my summary up front, and then we're going to practice and just wrestle with these issues in different ways. I'm arguing if you're doing an impact evaluation, if you're reading someone else's impact evaluation, you're reading someone else's latest theory or model of how to do impact evaluation, credible, defensible impact evaluations bring 4 types of evidence to bear. They have to demonstrate an association between program participation and the outcome. They have to establish temporal order. Participation happens first, outcome happens second. They have to rule out alternative explanations for the achievement of the outcome. And then finally, they need to identify a plausible mechanism linking the treatment and the outcome. Those are the 4 bits of evidence I'm arguing every impact evaluation should strive to include. Here's a different way of looking at the same thing. So these first 3, demonstrating an association, establishing time order, ruling out alternative explanations. One way of saying, thinking about those is to ask, did the program make a difference? And then the 4th one, identifying a plausible mechanism, it's about how did the program produce this difference? And I've got a reference here to Cook and Allari and Russo, and you'll see that in my bibliography. And Cook and Allari Russo, they're all making the same point. It's not enough just to do 1 to 3. It's not enough to do 4 on its own. You need all of them because the methods are complementary. You want to know if there is a difference, but you also want to know how that difference came about. What is the causal production process? So that difference making and mechanism studies can be mutually reinforcing. They compensate for each other's weaknesses. Here in Australia, our Assistant Minister for Treasury often uses medical examples and advocates for the benefits of experimental methods. What the assistant minister forgets to tell you is they use mechanism studies in health all the time. Vaccinations would be a great example. Yes, you want to know if a particular vaccination works, but medical researchers also unpack the mechanism. Well, the vaccination activates this enzyme, which attacks this protein, which causes. And they actually get involved in the lab and play around with mechanisms to intervene to see how it works. So we actually want both. We want to know about the program making a difference, and we want to know how it works, the mechanism. Now, if you have a correlation between program participation and some outcome, say job training, you've got a group of people, some who did the job training program, some didn't. You've got the achievement of an effect and outcome like getting a job. There's a correlation between this program and this outcome. There are 4, and I'm going to argue only 4 possible explanations for what's going on. And the first explanation is it's pure chance, it's methodological error, it means nothing. That's my wheelchair and potato chip example. Yes, the data was true. There was a very strong correlation between those 2 things, but there's no mechanism linking it. It's just an artifact. It means nothing. You could say that perhaps there's a correlation between the price of scotch in Sydney and the number of blue-winged butterflies in Prague. Again, means absolutely nothing. But anytime you have variables that have a trend in them, they will correlate. You have 2 variables, they both trend upwards over time. Those 2 variables will correlate, even though they may have absolutely nothing to do with each other in a causal sense. The second possible explanation is that participation causes the effect. So 2 things can correlate just by chance. It means nothing, or it might be our treatment or intervention is causing the outcome. This is the one that we might be hoping for. There's still another option. The people higher on the outcome actually go and seek out the program. So you get a correlation between the 2, but it's actually the effect that's driving program participation, not the other way around. People with slightly higher incomes are more likely to participate in microcredit programs. So they found out in international development. Or adults who are slightly better readers might be more likely to join an adult reading group. In this case, the outcome is related to the participation. And this aspect of, and this is where establishing temporal order is really, really important. So you get a sense of which one could be the potential cause of the other one. Depression and heart disease are related, but heart disease causes depression. Depression doesn't cause heart disease. And it's important that you can establish temporal order when you're trying to test for impacts, causal effects. There's still one more to come. This is the external factors that drive both programmed participation and the outcome. These are hard to understand, they're hard to test for, they're hard to control, and they're also really, really common. An example could be motivation. I've called that Z. Could be the factor that drives both program participation and achieving the outcome. I went to a presentation at the last year, 2 European evaluation conferences ago, where a person took a cross-sectional survey of job participants, matched them to non-participants, and said the job training worked really well in Ireland, leading to increased employment. And I asked her in private, because I didn't want to cause embarrassment, how did you control for spurious effects, the Zs, things like motivation or better skills? Oh, well, I didn't. I just assumed them away. And that's actually a common response from people using econometric methods to try and disentangle program effects. It annoys me, which is why I mentioned it. But we need to be aware of these Zs, which either means you have subject matter knowledge, or you get access to people who have subject matter knowledge, and you identify what they are, and you have to control for them. And I'll talk a little bit later on how you do that sort of control. So I'm arguing to be trustful, credible, and useful. An impact evaluation must, none of these are negotiable in my view, must demonstrate an association between participating in the program and achieving the outcome. Establish time order by measuring participants before, during, and after the program so that you know the program happens first, the outcome happens second. Number 3 is you have to rule out these alternative explanations, whether it's motivation, the effect of other programs, long-term trends in the environment, whatever. You have to identify them and rule them out. And then finally, you want to have a plausible mechanism linking the outcome and the intervention. And that's important because sometimes you can have spurious correlations that are just two trends that correlate, but they don't mean anything. So you want to know about mechanisms to help unpack that issue. And this fourth point about plausible mechanisms, well, this is the domain of theory-based impact evaluation methods like contribution analysis, qualitative comparative analysis, process tracing, or econometric methods too, are all techniques that people use to try and unpack mechanisms and how they work. So let's practice with a couple of examples. We'll just think through them together out loud. Again, real data. There is a correlation between the number of iPhone sales and the number of deaths in Australia from falling downstairs. Well, if you're anything like me, sometimes you walk around holding your phone. I tripped over once in the street on a curb. I was reading my phone and I fell over when I tripped on the curb. How embarrassing was that? And these two young guys grabbed me and popped me straight up. But this is real. What could be happening? Well, as per my example, you can imagine you're reading your iPhone and you fall down some stairs. But as you might suspect, it's just spurious data. It means nothing. There's a upward trend in number of iPhone sales, and there's an upward trend of deaths from falling downstairs just because population increases. So these two things correlate. There is no mechanism. It means nothing. Oh, this is a good one. I like this one. This is true too. The more firemen that are sent to a fire, the more damage that is done. So you've got a fire going, and if you send 5 firemen, well, they break down your door and do some other stuff, squirt their water. But maybe if you send 25, they start chopping into the woodwork with their axes and doing all sorts of things. Well, if you think about it, that explanation probably doesn't hold water either. What's actually going on is when you have a really big fire, they send lots of firemen. And so you get more damage. So the size of the fire is Z, the alternative explanation. So a big fire leads to more firemen, X, and the effect outcome is damage. So it's not the firemen causing the damage, it's the size of the fire causing both more firemen to be there and more damage to happen. I'm trying to encourage us to think in this way. People write books on how to draw these diagrams, and they have a funny little name. They're called directed acyclic graphs. And I've got some references in my reading list about this, but I find it personally really helpful when I'm trying to get my head around an impact evaluation, what I might measure, to start drawing little funny diagrams like this. It could be the program, or it could be this, or it could be that, to help me get my head around it. Here's just another example. There is a correlation between increased use of sunscreen and higher rates of cancer, which is probably the opposite of what you'd want. But of course, what happens is people who go to the beach all the time, they put on lots of sunscreen. And people who don't go to the beach don't put on lots of sunscreen. And that drives the correlation. But it's not the sunscreen causing the cancer. Going in the sunshine is causing people to get cancer, and it's also causing them to use sunscreen. So it's a bit misleading. Oh, this is another interesting one. I saw some research that found that there was a strong correlation between hours of schooling and wearing glasses in South Korea. I couldn't figure that one out. That really baffled me. But it turns out that spending time indoors without natural sunlight makes it more likely for children to have to wear glasses. So it's not the schooling per se that causes the increased need for glasses. It's being indoors a lot and without having ultraviolet light to stimulate your eyes in some way leads to the need for glasses. That was quite a counterintuitive one. All right, here's another one. Eating sugar as a child is associated with adult crime rates. That's true. And you think about that and you think, oh, well, does eating lots of sugar do something to your biology that makes you be a criminal later? Or maybe it's the Z in this case is poverty. Kids growing up in poverty tend to eat more sugar and they tend to commit more crime later as adults. So I'm just trying to sensitize you and invite you to think a little bit differently when you see a correlation, to think, oh, okay, there could be a few different things going on here, rather than just leap to the conclusion the program's causing the outcome. This is real data too. There's a strong correlation between autism and the sale of organic foods. It almost invites one to immediately jump to the conclusion that I'm not feeding my kid organic foods. But as you probably have guessed again, it's just a spurious correlation. There's no mechanism linking the two. We just have two variables with a long-term trend in them upwards. And because there's a trend, they correlate. That's all it means. If I used a less obvious example, it would be more clear, I suppose, like strong correlation between the number of cars on the road and the consumption of hummus. That doesn't sort of invite you to think one caused the other, although the autism organic food did. Or how about consumption of margarine and divorce rates? Those two correlate highly too. One that's currently being debated, and I'm not sure we have the full answer yet, is a strong correlation between screen time and depression in teenagers. That's being researched and debated fairly actively at the moment. I'm not sure on the result of that one, where it's going. But it makes you wonder if there's going to be a similar issue, or if there's going to be a mechanism, or maybe something else causes them both. This is a common one you come up across in the literature, that participating in job training and employment outcomes. Those who do the job training get better employment outcomes. Well, the criticism of that one is, yeah, but it's the people who are highly motivated are the ones who go to the job program training, and the highly motivated people were more likely to get a job anyway. So maybe it's not the program, maybe it's the motivation that makes the difference. So if you're doing a study like that, you'd want to control for motivation to remove its effect out of the relationship. And I'll talk in a minute on how people do that. Yes, this was one that was debated a lot in Melbourne because they had, I think, some of the longest public lockdowns and a significant number of COVID deaths. And there was arguments by some that the length of lockdowns was associated with the deaths. But of course, it's not immediately clear to me if being locked down more longer led to deaths, or because there was deaths, they extended the lockdowns. I'm not actually sure which the temporal order as to which happened first here. This one's my all-time favorite example. I love this one. You know, for many years in Western countries, people would get surgery for ulcers. And that's been well researched. And 70% of doctors and 80% of patients would say the surgery helped their ulcers. It was good. The only problem is they're completely wrong because most ulcers are caused by a bacteria. There's the Australian doctor who drank the bacteria, gave himself an ulcer, took antibiotics, got rid of it. Drank the bacteria, gave himself an ulcer, took antibiotics, got rid of it. He did cycles like that to prove quite nicely that bacteria were a cause of ulcers. And yet, 70% of doctors, 80% of patients reported that the surgery helped them. I use that because I don't mean to discredit getting views from program staff and program participants, but I do want to say that let's not confuse their satisfaction, program impacts, causal inferences. These are different concepts. They're measuring different things. This is a juvenile offenders program that I led many years ago, and I was really proud of it at the time. It was in a small country town in Western Australia. And in 1993, there was about 440 juvenile offenses where people were charged. And then I had a street workers program, recreation activities, voluntary work program, was running a school part-time for these kids. And then 2 years later, offenses were down to 350, which is about a 20% reduction. And I'm going, gee, wasn't I good? That was really clever of me. So this before and after comparison, I invite you to reflect. Is that enough? This 20% before and after reduction, is that enough for me to puff out my chest and say, oh, gee, my program has been really good? Well, as you might be guessing, there was something else going on in this one that I didn't know at the time. And that's that other effects were going on. The police department changed who they charged and who they didn't. So they started giving more cautions. Maybe my program had an effect, but I'll never know because they started charging less children and giving them cautions instead. So my numbers weren't comparable over time. Whenever you have one of these before and after sort of situations, I've called it a gross observed change, that 20% reduction. It's actually made up of about three different things. One thing is the program's net impact, if there is one. Another thing it can be made up of is methodological error. And finally, the effect of other events and processes. So what you want to be doing is minimizing your methodological error, measurement error, sampling error, analysis errors, all that sort of stuff. Controlling for the effect of other events and processes. And then what you're left with is the net program impact. Well, what are these other events and processes? Extraneous events, other programs, general trends in the population, maturation of clients, all this sort of stuff, selection biases. So how do you control for them? Well, that's the function of randomization in a true experiment, is to control for the effects of other events and processes. That's exactly what it is meant to do. But that's not the only way. You can use a control or a comparison group. If you can get one that matches well, that's another way. If you know what these other events and processes are, you can identify them, measure them, and then you can control them statistically. This is what econometrics is doing all the time. You can identify them and then try and use logical argument to rule them in or rule them out. I was doing that all the time in my work in international development because that's what I would have: a simple before and after, limited data, lots of stakeholder views, and then I would try and work out, okay, rates of school completion in rural Papua New Guinea have increased. Could it be because of our program, or what other events were going on? And I try and rule these other events in or out. Well, the other thing to do with these effects of other events and processes is to pretend they don't exist. And you see that quite often in the published literature, and it disturbs me. So a gross observed change, program impact, effect of other events and processes, methodological error. And I've suggested you minimize error, you try and control other events and processes. So then what you're left with is a net program impact. And I've suggested a few ways you can do that. And if you didn't write everything down I just said about control, that's okay. It's on the screen and you get a copy of this slide anyway. This is again real data from the US about the unemployed single mothers join an employment program. And this is the percentage of those who have employment over a 5-year period measured every quarter. So quarter one, what's that, about 18%, all the way through to quarter 20, what's that, close to 50%. So it's going up over time. So this is looking pretty good. But before versus after comparisons can be a bit misleading. This is the same data with a control group on it, and all of a sudden the program doesn't look so good. This is the real data again. So actually it doesn't look like the program did anything different than the natural trends in the economy itself. Didn't add anything over and above what was already happening. So policymakers generally want to know, does something work, at what cost, what do stakeholders think? And this is all good. I would also just try and alert us to the fact that interactions are common. And interactions mean the program has different results for different groups of people. Perhaps the program works well for males, but not females, or works well in urban areas, but not rural, or works well for this ethnic group, but not that one. Those sort of things are really common. It happens occasionally in medicine. In the United States, if you're a Caucasian person with high blood pressure, you get one drug. If you're of African descent, you get a different drug because they work slightly differently. Those things aren't that common in medicine, but in social programs, they are almost the norm. So we should be looking at that. And when we do our impact evaluations, we should be trying to consider how we could disaggregate the results so we can see different patterns for different groups. I've been arguing in a few different ways that in order to conclude that this program causes that outcome, there's 4 bits of evidence that we need about association, time order, ruling out alternative explanations, and identifying a plausible mechanism. I'm not personally fussed if you like to use experiments or you're into case studies, you want to use surveys and economic methods or process tracing, contribution analysis. I don't mind what sort of method you want to use, but I do want your method to be able to demonstrate these 4 types of information. To me, that is the name of the game, that evidentiary requirements are what we pursue rather than Scott likes doing quasi experiments, so I'll do that. What I should be focused on is the evidence I need to reach credible, defensible conclusions rather than just pursue a method-driven approach. So this little funny diagram with the strange name, I find it really helpful to draw up these little things when I'm considering how I'm going to approach an impact evaluation. And I've given you a reference to a book. The whole book's just about drawing these things and the rules about what you need to control for and what you don't. I suggested a second tool for a way of thinking about before versus after comparisons and what you might need to control for and how you can do that. My argument is we should be trying to select the strongest possible research design. That is to say, the design that does the best job of giving us the 4 bits of evidence I said are essential, and then add additional research designs and measures and features until you adequately cover off on the 4 criteria. To me, that's the name of the game. And as an example, I've got a reference here where a fellow is doing a quasi experiment, but there's a lot of problems with it. So we add some features, there's still some problems. We add some more features. I think he added 3 or 4 layers compensating for all the weaknesses. And I thought it was a great example of the logic he's thinking through and how to compensate for the limitations in his initial design. And I need to mention that conducting an impact evaluation assumes a consistent intervention plus fidelity of implementation. If you're not certain about those things, I don't think you're ready to do an impact evaluation yet until you are certain about the quality of the intervention and the implementation. I wanted to offer a warning about sometimes in published literature, I see things where people get a little bit confused and they'll confuse building a theory of change with doing an impact evaluation. No, a theory of change might help you, but it's not the impact evaluation. because we need association, temporal order, ruling out the rival explanations, as well as a mechanism. So yeah, building a theory of change is not the same. Similarly, seeking evidence to support or confirm a theory is not the same as an impact evaluation. Building a theory using your data, yeah, that'll help you show linkages, a mechanism, but it doesn't give you temporal order, and it doesn't rule out rival explanations, the things I'm calling Zs. Similarly, portraying the views and experiences of program participants and staff is not the same as an impact evaluation. It can be handy, but as per my ulcer example, it's not necessarily the same. Where I have seen the experiences of program participants being useful is when it's quite structured, like you're getting farmers to keep a diary of how they're using water and fertilizer and relating that to crop growth, but it has to be highly structured. And also similarly, seeking the opinions of experts. Yes, it's quick and it's simple. We'll go and ask the experts what they think of our program. The only thing is it's not very accurate. This fellow, Martin Ravelin from the World Bank, did a lot of research on that issue with employment programs. What he found out was he showed an employment program to a group of employment experts and asked them to predict whether the program was going to work or not. They couldn't. They were guessing. There was no substitute for actually going out and getting the data. So the problem is methods that are quick, simple, and relatively inexpensive give us information that tends not to be very accurate. And methods that are highly accurate tend to be much more expensive and time consuming and labor intensive. And so there's a trade-off we all need to make every time we do an impact evaluation about how much accuracy do I have versus how much do I need versus how much time and money do I have to spend on this. And you're always going to be trying to balance that up depending upon your situation. And sometimes in some occasions, like the pilot program looking to expand it to around the country at a cost of hundreds of millions of dollars, you might want accuracy above all else. But if something was more of a mind tuning, the minister just wants a bit of basic reassurance, you might be more comfortable just relying on participants' experiences and perceptions. This is a list of potential comparisons. When you're doing an outcome evaluation, you're often looking to make comparisons. I'll leave you to read that over time with yourself because you'll have a copy of this, just a brainstorm list of things you can think about. I was in two minds about including this slide because my message is about evidentiary requirements and paying attention to that first and foremost, rather than particular methods. So this is sort of contradicts my position a little bit, but people seem to be interested in this. So there's quite a good body of evidence now. And when you see my annotated bibliography, you'll see there's quite a volume of information now. We have a pretty good idea of the stronger non-experimental research designs. Regression discontinuity designs where participation in the program is depending upon an initial cutoff score. Using that method works really well. There's absolutely no doubt if implemented well, it gives you highly accurate results. Similarly, a time series, an interrupted time series with a comparison group, they're also very strong. An expanded version of that called the multiple baseline design, where a program can be implemented in phases around different locations or regions. That also works really well. Cohort designs, a cohort of like this year grade 11s compared to next year's grade 11s versus the year after, that tends to be not too bad too. I'll make a caution though, down the last dot point here about comparative case studies or dose response models. You need a really good program theory that you're confident in. You need good data, and you still have to be quite careful about confirmation bias. Remember how we can see the things that we go looking for? If I go look in the clouds for faces of my children or ex-wife or whatever, I'll be able to see them. Well, this is the danger with pattern matching with these sort of passive observational studies. There are high risk of confirmational bias, so you need to be aware of that and put strategies in place for dealing with it. This is what I've called the guiding principle, is based on my understanding of the literature. that good impact evaluations, credible, defensible results. We want to use high quality outcome measures, match local groups. By local, I mean geographically proximate program comparison groups on pre-treatment outcomes, control for self-selection. By that, I mean differences in motivation, incentives, and measure outcomes at several times before, during, and after program participation. If you can do all those things, it doesn't matter that much which specific method you use. This would seem to be, based on the current evidence, literature, what will be most likely to give you a good result, an accurate result. We're getting very close to the end now. This is my finale slide. So there's a few different approaches to impact evaluation. There are those who like to do what I call method-led approaches. You know, I'm an experimenter, and everything I do is an experiment, or I'm a cost-benefit guy. I worked with someone once, no matter what evaluation we were doing, this fellow found a way to do a cost-benefit study. Or you can do it econometrics. And these folks are into counterfactuals and difference making. On the other hand, another group, the program theory-led folks, they like to do case studies, contribution analysis, process tracing, and they're particularly interested in mechanisms and contexts. And these two groups fight. They each say they're right and the other side's wrong. And I think they're both wrong. Cook and Laurie Russo, they have a good discussion on how these approaches are complementary. Cook's got good arguments why theory-led experiments would be a good idea, even though we very rarely see them. So rather than digging a hole and jumping in the methods camp, being a program theory-led advocate, I think there's another way. And this other way is what I'm trying to advocate for, is rather than focus on methods or theories, I think we should be attending to evidentiary criteria. That is to say, focus our efforts on deciding, agreeing on what evidence do we need to make credible, defensible conclusion about program impact, and then adapt our methods to gather that information for us. And I've offered one particular philosophical school, critical multiplisms approach, that I happen to like. But if you've got someone else you like, that's fine. But my main message is I want us to be focused on evidence for good conclusions rather than I want to focus on evidence for good conclusions rather than methods themselves. So I've got a quiz question for you. And this is true. In 2006, a World Bank study found that better at monitoring and evaluation is associated with improved outcomes of development projects. Does this mean that monitoring and evaluation is an effective way to improve development results? I'm inviting you, you don't have to tell me what you think, but I'm inviting you to mull this issue over. And if I was in your shoes, the first thing I would do is start drawing it with an XYZ diagram about what might be going on here. Is X causing Y? Is Y causing people to join the program? Is something else, Z, causing both? Just mull that over for a moment, and then I'll tell you what I was actually found.
People, feel free to write your answers in the chat. I have one answer so far.
So if I ask this question in a different way, what I've done is I've told you there's a correlation between monitoring and evaluation and development outcomes. And then I said, does that mean, because these two are correlated, does that mean monitoring and evaluation causes the outcome? So one explanation could be that monitoring and evaluation causes a development outcome. Seems unlikely to me that development outcomes would cause people to do monitoring and evaluation. And what they actually found in the World Bank study is that Programs that had highly skilled team leaders had better monitoring and evaluation, and they also had better development outcomes. So what was driving this relationship? Most of the strength of the relationship was because of the Z, the skills of the team leader drove better M&E, and it drove better development outcomes. And once you controlled for the skills of the team leader statistically, monitoring and evaluation had an effect, but it was only small. And I was a bit disappointed in this results, being an M&E advocate, but that's what it showed. So I'll stop at that point, and if anyone would like to ask me a question or disagree with something I've said, that's fine. We can have a discussion of the literature, or if you have a different view, I'd love to hear it.
Scott, so I have a question and then I'll give it to Kara. Scott, I was wondering if it's possible to estimate the duration of an outcome. Is it through interviews, like asking people how long do you think this effect would last, or triangulating with secondary sources of information? How would you go about that?
Oh, yes. What a great question. I think the pattern of outcomes is something that's hugely under-examined in evaluations. For example, you might get a strong effect that lasts for a month, or you might get a medium-sized effect that lasts for a year and then tapers off, or sometimes in the US employment program evaluations, they look at a person's increased level of income for 2, 3, 4, 5 years. But it means if you actually want to know literally how they have changed over time, you're going to have to track a sample of people. Yes.
That is the way. That is the way to know for sure.
Yeah.
Thank you, Scott. There's a question by Kara. Kara, do you want to? If you don't want to unmute yourself, I can read it out.
Hi, Scott. Yeah, sorry, I'm just being the grumpy old cynic. And actually asking for your advice, because people want impact evaluation, but they're not usually prepared to pay for it. Good data costs money for the skilled people to do it, to plan it in, often ideally with baselines, blah, blah, blah. But people are often not so keen to spend the money on it. Now, I know that you're doing plenty of work probably with ACE over in Australia, but yeah, what's your strategy to try and say it's going to cost you some money?
So I would spend time with trying to understand who wants this piece of work. And it's often not the person who wrote the terms of reference or the RFQ or the person who answers my questions by email. I want to talk to the person who's usually more senior who actually wants this to try and tease out, what are you going to do with it? Michael Patton gives examples where he says to people, oh, well, if the results said this, what would you do? On the other hand, hypothetically, if the results said that, what would you do? On the other hand, trying to understand their context and use. And so that's my first point. And then I would talk about their data availability, their time frames, their resources, and what level of credibility, confidence they are likely to get based on different types. If you just want a rough sense of something, this might work for you. If you want to know what stakeholders think, hey, that's great, we can do that. But if you want a defensible causal impact conclusion, I can't do that for you in 3 months and with the data you've got. The other thing I did when I was a staff member at the Asian Development Bank and then again at Department of Foreign Affairs and Trade, I would try and avoid bad jobs. And by that, I mean, I would try not to get involved in jobs where there wasn't a clear stakeholder who wanted something, knew what they were going to do with it, and had adequate resources to do the job. If I could find those sort of jobs, hell yeah, I'll work on that. And if it was not that sort of a situation, I'm more likely to say, oh, sorry, but I'm kind of busy. As an external consultant, I'm much more able to do that, pick and choose what I work on. But as an internal staff member, I couldn't. I think in the last 5 years, I've probably interviewed 10, 12 deputy secretaries of Australian Commonwealth government departments. I'd say 2 of them were strongly committed to using evidence to inform policy. Maybe 3 of them were dead against it because they're afraid of the political exposure if the program was shown not to work. And the remaining, 5 were sitting on the fence, sort of like, yeah, evaluation's a good thing, but gee, it's a bit tough, it's expensive, might cause problems for me or the department or the minister, so I'm not sort of sure. I think when we do evaluation capacity building, we often want to train the delivery people, the program staff, or the evaluation team, or we want to focus on what I'll call the infrastructure, your policies, your systems, your databases. I think the third piece of the puzzle is leadership's demand for and ability to make use of performance feedback. I think that is the missing piece of the puzzle in Australia, at least. And I've had this discussion on numerous occasions with the Australian Centre for Evaluation. And I'll say, hey, you guys, yeah, train people, have new policies, but what are you doing with the leadership group? I think that's the missing part.
Yeah.
Do we have any more questions before I ask the last question of Scott? Anyone else would like to unmute themselves?
I do have a follow-up if no one else does.
That's okay, Kara. Go for it, and I'll squeeze in after you.
I'm actually curious, Scott, if you've been in a position where you've counseled people out of an impact evaluation.
Oh, yes. Oh, yeah. Quite a few times.
Yeah.
And they usually didn't listen to me. It happened quite a few times in Department of Foreign Affairs and Trade, and I'm currently working part-time in the health department. It's happened there several times. Because I'm saying, well, let's do an assessment and evaluation of the program's design if it seems plausible. Let's look at its implementation. Let's see what the early monitoring data is telling us. And only after we've done all those things, let's think about impact, because maybe this program needs 3 years, 5 years, or 10 years before we could reasonably anticipate some outcomes. And so I've had that discussion with program people many times saying, no, you haven't looked at implementation and design yet. It's too soon. Oh, well, we'll do that and impacts at the same time. I said, yeah, but the problem with that is if your implementation is flawed, it's too late to correct it. But usually there's political pressure or some other reason that they're just going to go ahead anyway.
Yeah.
So I'm in the position of trying to offer advice on how to do a reasonable job in difficult circumstances.
Thank you so much for the amazingly educational seminar, Scott. Before I close the seminar, and there are also many thank yous in the chat for you. Can you explain what a regression discontinuity design is for those of us who don't know much about it?
Yeah, I know. Sometimes I use jargon, but that's an important one. In my list of annotated references, you'll see several articles that'll give you an introduction to that topic. But just briefly, when you have a program where entry depends upon a cutoff score, like if your grades are above this, you get an award of TRIP or something, or if your income is below this minimum threshold, we'll give you a grant. Programs that have those sort of cutoff scores that determine your eligibility, they're fantastic for impact evaluations. You can reach very strong, credible conclusions at around the cutoff point about what works and what doesn't and the size of the impact. They're really good for that.
I see. Thank you so much, Scott. This has been a really informative and educational seminar, and I've learned a lot listening to you, and I'm sure everyone else joins me in thanking you. And also, just to plug in, Scott is doing a workshop very soon, right, Scott?
Oh yes, for the Evaluation Society, I'm doing a half-day workshop on this same topic. But the messages are basically the same as today, but it's expanded and there's more hands-on work on your part and less lecturing by me. That's on the 25th of June.
Awesome. Thank you so much, Scott. And thank you, everyone, for participating.
Yep. And look, we'll send you a copy of my slides. You'll see my
Yeah.
bibliography. You're welcome to send me an email if you want to kick around an idea. I like these sort of discussions. I find them fun.